Scleroderma is a rare skin condition. Discovered years ago, the autoimmune disease has no cure. Today on Sound Health, our focus is on raising awareness about the disease. I'm Olasumbo Modupe. Welcome to the show. On Innovation this week, researchers showcase first ever treatment for hypoactive sexual disorder desire. The program continues shortly. Please stay with us.
Elizabeth Ozumba was diagnosed with scleroderma 7 years ago. Like other thousands living with the rare skin disease, she was confused and not at peace with what nature offered her.
The body just turns against itself and starts destroying healthy body tissues. From then till now, it's been a long walk, and the experience has been out of this world. It's something better experience than imagined, if I may say so.
Scleroderma means hard skin, but hardening of the skin is just one of many symptoms scleroderma sufferers experience. It is an autoimmune and rheumatic disease causing stiff joints, digestive issues, lung scarring, and kidney failure.
So patients could complain of hardening of any part of the skin, could be on the hands, could be the upper arms, could be the trunk, could also be the face. So typically they could have that. They might not notice it, and some of them would. They also could have discoloration, so they have blotchy skin. They could also have swelling of the fingers, and when you see how you can lift up my skin, theirs is bound down, it's tight, you can't even pinch it up. So they would come and tell you that there's something wrong with how my skin feels. They could also have swollen fingers, they could have ulcers at the tip of the fingers as well.
For Abiola Segun Williams, who was diagnosed 2 years ago, accessible and affordable state-of-the-art facilities should be in place to give succor to people living with scleroderma and other life-threatening conditions.
I don't think we still have the facility. We have a place we could go and have the test done. Your blood will be taken, but it's still sent abroad, sadly. Well, as at the last time I did my test, it was sent to Namibia. I had to go for my treatment in India. I've gone to India twice, and the treatment is very cheap compared to what it is in Nigeria because it's subsidized by the government.
Scleroderma has no cure and most commonly first present between the ages of 20 and 50 years, although any age group can be affected. Women are 4 to 9 times more likely to develop scleroderma than men.
It's still Sound Health on Lagos Television, and today on the program we'll get first-hand information about scleroderma with the help of Dr. Femi Adelowo, a professor of medicine and a rheumatologist with the Lagos State University Teaching Hospital. He's also the president, the League of African Associations of Rheumatologists. Welcome to the program, Doctor.
Thank you very much.
It's so good to have you on the show.
Thank you very much.
So, Doctor, in basic terms, what is scleroderma?
Well, scleroderma belongs to a group of conditions we call autoimmune disease. Sometimes we also call it connective tissue disease, and we also call it systemic autoimmune disease. The essential thing is that an autoimmune disease is a condition where the body appears to be at war with itself. Quite a strange concept. And this war can be fought in many structures of the body. In scleroderma, this war is being fought on the skin, but it's also fought in other internal organs. But two things are happening. One is that you have excessive deposit of scar tissue under the skin and in the skin. You have excessive scar tissue in the lungs, excessive scar tissue even on the heart and in the intestine and in the kidneys. You also have disruption of the blood vessels. So those are the two things that occur. Other autoimmune disease or connective tissue disease affects so many other structures. You have one that affects muscles, which we call polymyositis. And you have one that affects virtually everywhere, which we call lupus.
Okay. It is an autoimmune disease with no cure. Can it be aggravated by allergies, genes, environmental factors?
We do not, as of now, know the exact cause, but there have been a lot of suggestions. We know that it's an interplay between something in the environment, maybe like some virus, and viruses are rather difficult germs, because when they come in, they disrupt the whole immune system or the defense system of the body. It's like they come in and hack, just like we can hack into the
system.
Internet, they hack into the system, take over the system, and make the white blood cells, who are the soldiers of the body, make them fight among themselves or fight other structures. But there's also the possibility of a gene. The gene is something internal, because there are certain people who have certain genes that predispose to this. There seem to be some other factors. Drugs, for instance, there's quite a lot of drugs like what's called bromocriptine, vinyl chloride. There are things like silicone, and it's been found to be associated, for instance, with women who have silicone enhancement of their breasts. So quite a lot of factors. Rape seed oil, adulterated oil is another factor that's been implicated. And those working in the mines are also predisposed to it. So quite a lot of factors. But the basic thing is that it's an interplay between something in the environment, like a virus, and the gene.
It was discovered years ago, but people still hardly know about the condition, unlike other skin-related diseases. How common is this condition in Nigeria? How common is scleroderma in Nigeria?
Well, it is not a particularly common condition, but when it strikes a person, it is so obvious. In a recent review of 4,000 patients seen in a rheumatology clinic, only about 29 had scleroderma. Part of the problem may be the difficulty in diagnosing it. Many times it comes like many other skin problems. But for the patient, they will tell you that they feel their skin is choking them. They will feel, they know their skin is plastering to their body. And when they try to pinch their skin, they're unable to. Which you and I are able to pinch our skin, but they are not able to pinch their skin because of that scarring of the skin onto the underlying tissues.
Okay. According to a study, it can take a very long time to fully reveal itself, making diagnosis a huge task. What's your take on this?
The basic way we can diagnose is the way the person presents. Like I mentioned, the first thing they notice is that they feel that their skin is getting thickened. They feel they're having some itching sensation all over their body. And because the other internal organs can be affected, many of them may actually come in with a cough that is not productive.
Okay.
They come in with dyspnea. They also notice this mottling on their skin, what we call the salt and pepper appearance. This is a mottling between something that is darkening and something that is lighting. So it's like a mottled skin. Sometimes they notice some color change in the tips of their fingers, which we call Raynaud's phenomenon, in which the skin changes color from being white, then turns to blue, eventually to red, and that's associated with certain pain. Many patients will complain of that when they're exposed to cold. Few of them would talk about feeling reflux. Reflux is they eat food and the food comes back, and they may also have constipation. If it affects the heart, they would have irregular heartbeats, and they may also present with heart failure. So there's quite a diverse presentation, but it's the patient's word that really would lead us to diagnosis. Blood tests, there's certain blood tests we can do. We call it serology. The serology test we can do. We can also use magnifying glass to look at the tips of the fingers to see the blood vessels that are in disarray. The blood vessels just become in disarray. They are not organized like you see in normal persons. We can also take a bit of the skin and do what we call a biopsy. So all this will contribute to the diagnosis.
Okay. Scleroderma most commonly first presents between the ages of 20 and 50 years. Women are 4 to 9 times more likely to develop this condition. How true is this?
Yeah, this is very true. Most connective tissue disease actually picks on the women mostly.
Why? Why is this so?
And the reason is because the estrogen hormones, which the women have excess of, is very important in our immune system, in our defense system. Unlike the male hormone, testosterone, which is not important. So is the excess of the estrogen hormones, and because this is a condition in which the immune system is in disarray, the estrogen hormone, which is important for it, sort of fuels this disarray. That's why women are more commonly affected than men.
Okay. Is it deadly or contagious? What is the survival rate for people living with this condition?
It is not contagious, because the origin is from inside, it's not from outside. So you can rub skin with anybody, it's not going to make any difference.
Okay.
Now, it could be, like in all conditions, it could be deadly if not properly diagnosed and treated early. So the key thing is to make an early diagnosis and get a dermatologist or a rheumatologist to manage.
Okay.
That's the key element. And not just applying all sorts of cream, because that won't work, unfortunately.
So scleroderma is not associated with cancer of the skin. I need you to clarify this, doctor.
It's not cancer of the skin. It is just because the skin is thickened, because there's scarring in the skin. That's what it is. It's not cancer. It may look cancer, but it is not cancer.
Okay.
And I think when you go to see your doctor, he'll be able to tell you specifically, and you may take a skin biopsy. So please don't let us assume that it is cancer. And if you have such a diagnosis placed, you have a right as a patient to ask for second opinion or even third opinion. It's entirely your right to do so.
Okay, so scleroderma is an autoimmune disease. What is the relationship between this condition and rheumatism?
When we talk about rheumatism, we're only meaning that there's pain in the joints. And that pain is not coming from the bony parts of the joint. It's coming from what you call the soft tissue, the surrounding muscles, the surrounding tendons or ischium that surround the joints. Now, all autoimmune diseases are capable of presenting with joint pains. So that's the relationship between scleroderma and what we call rheumatism.
Okay. Doctor, it was discovered years ago, but it is devastating that it still has no cure.
Yeah, unfortunately, but that's not to say that there's a lot
cannot
of
be managed.
research. There is a lot of research going on. There are a lot of new agents that are coming to the fore.
Okay.
But like in many conditions, we talk about management. Just like when people have hypertension, there's no cure.
Okay.
When people have diabetes, there's no cure. So this condition, what we do is management. And by management, it means if you're taking your drugs, you can effect a cure. When we talk about a cure in absolute terms, a cure means you have a condition, you take your drug, it goes away. That's it. Don't go and see your doctor. But in this case, you have to be managed. Just like when people have hypertension, they have to be managed because they are taking their drugs.
Okay. Medical experts and people living with the condition are seeking ways to increase advocacy because I understand every June 28th is set aside as World Scleroderma Day. Do you see this happening? Do you see the awareness level being raised soon?
I think so, because this will be the first time we're celebrating the World Scleroderma Day.
Okay.
And because this is a yearly event as determined by the WHO, because WHO that determines it. And this year is to tell people that scleroderma should not take away your smile. The smile is very important for people, and when you have scleroderma, because of the affectation of even the mouth, it sort of makes the person, not able to smile as well as they should. So I could see the awareness increasing. We have many more clinics all over the country now.
Okay.
Rheumatology clinics and also dermatology clinics that are picking these patients up early and they're intervening early.
Your final words to people living with the condition.
Well, don't give up hope. I think it's so easy to start wondering, was it a spiritual attack? Like that's something we get so
often.
It's not a spiritual attack, and I think people should learn to recognize the value of reporting in the hospital early. They should also recognize that if they're not satisfied with a particular diagnosis, they should consult other doctors. It's their right as a doctor, as a patient to do so. Then thirdly, that they should recognize that they should not be applying all sorts of creams because these things will not work. And they should avoid all this concoction that people would give to you, that because they think it's something.
No to alternative medicine.
Yes, we do not have any evidence that it works. And many of these conditions, you have to show evidence that it works.
Okay.
So that's and also not to give up because there are quite a few drugs in the pipeline that are coming up. And we hope, and like in all things in medicine, we start off initially by trying to manage it, then eventually we get to a stage where we can talk about a cure. And I think that's our long-term hope.
Okay.
Right.
So, Doctor, this is where we end the interview segment on the show. Thank you so much for sharing your expertise with us on sound health.
Thanks so much.
All right, that was Dr. Femi Adelowo, a rheumatologist with the Lagos State University Teaching Hospital and the president of the African League of Associations of Rheumatologists with managing scleroderma. Sound Health continues with trending and home essentials. Please stay with us. The program continues shortly. It's still Sound Health on Lagos Television. On Innovation this week, we showcase the first ever treatment of hypoactive sexual disorder desire. Please don't go away.
First ever treatment for HSDD.
There are drugs that address loss of male sexual function, but there have been none that address loss of sexual desire in women. It is believed that 1 in 10 premenopausal women are affected by HSDD. Hypoactive sexual desire disorder is described as the long-term loss of desire that results in distress or interpersonal difficulty. HSDD is not caused by medical or psychiatric disorders, relationship issues, or effects of another drug. The FDA has approved the first drug designed to treat female HSDD. The drug increases the levels of the neurotransmitters, dopamine and norepinephrine, associated with sexual excitement, and decreases serotonin, associated with sexual satiety and inhibition. This neurotransmitter rebalancing of flibanserin is believed to restore a woman's sexual desire to her personal baseline.
That's Sound Health this week. Hope you enjoyed this week's edition. For comments and inquiries, please send SMS on 0818-815-3695 or follow us on social media at LTV Social, #SoundHealth.